Oh, that's our disclosure. Please pay attention that this study was supported by a research grant by Astellas, but the sponsor was not involved in the design and conduct of the study, collection of the data, management of the data, analysis and interpretation of the data. As you know, neurogenic Detrusor overactivity is a typical urodynamic observation in patients suffering from traumatic or non-traumatic spinal cord injury, and it's a very frequent observation in patients suffering from multiple sclerosis. Anticholinergics are considered the standard way to treat NDO. However, side effects, including the constipation, represent a significant limitation for a long-term treatment in a neuropath. Beta-3 agonism, beta-3 adrenal receptor Mirabegron is approved for treatment of idiopathic OAB with comparable efficacy and superior tolerability and in many countries around the globe. However, the conclusive data about the use of Mirabegron in neurogenic patients are missing. Therefore, the aim of our prospective randomized double-blind placebo-controlled study was to evaluate the efficacy and safety of Mirabegron in the treatment of NDO in the cohort of patients suffering from spinal cord injury and multiple sclerosis. In total, we enrolled 78 patients. 66 of them were included in the final analysis. After signing informed consent, all patients were advised to stop their anticholinergic medications. After 2 weeks of washout period, the patients were randomized into 2 arms, one with Mirabegron 50 milligrams per day and one treated with the placebo. We compared the urodynamic parameters and the urine leakage as measured by 24-hour bedway test, as well as patient-reported outcome parameters before and after the treatment period. What about our results? As you can see, we observed a statistically significant improvement of bladder compliance, as well as the volume of the first Detrusor contraction. There was a trend towards increasing the bladder capacity, unfortunately just below the statistical significance level. There was also observed a very strong numerical trend to reduce the urine leakage as measured by 24-PUT in favor to Mirabegron, and we observed the statistically significant improvement of all patients reported outcome variables such PPBC, incontinence quality of life questionnaire, and treatment satisfaction visual analog scale. What about safety? Total 7 adverse events in 7 patients were observed during the study. However, the incidence of the study drug-related adverse events was 3.1%. As you can see, we didn't observe any change in the bladder pressure, systolic and diastolic, and pulse rate during the study. Based on our results, we conclude that Mirabegron 50 milligrams improves both urodynamic and patient-reported outcomes variables in patients with NDO. The treatment with Mirabegron was well tolerated. Our data support the hypothesis that Mirabegron can be safely used in the treatment of NDO, and we believe that our data represent a strong base for additional dose-finding studies in the future. Thank you for your attention.
Some questions from the floor? I have a question. Did you evaluate the constipation or some other bowel function parameters?
Unfortunately, we didn't focus on the bubble function in this particular study. We wanted to put together a pilot data just to create a basis for next randomized studies, which is urgently needed.
Okay, thank you. Thank you.
Thank you.